Today I'm going to be showing how to do preparation and administration of subcutaneous and intramuscular injections. So first I'm going to go and introduce myself to the patient. I'm going to say, hi, my name is Rebecca. I'm a level 2 nursing student from McMaster University. Then I am going to go through my 8 rights and check to make sure that I have the right patient, the right drug, the right dose, the right time, frequency, site, route, and reason. So I'm going to check my doctor's order 3 times so I know that I'm administering heparin 5,000 units subcutaneous and Haldol 1 milligram intramuscular. Then I'm also going to ask the patient if they have any allergies. So I see on the order that the only allergy is codeine, so I'm going to check that with the patient. Then I'm going to assess the patient's body build, muscle size, and weight, and note that they're all average. So for the subcutaneous injection, it is heparin 5,000 units per 1 milliliter, so I know that I'm going to be administering 1 milliliter. I'm going to use a 25 to 27 gauge needle that is 5/8 of an inch long. And then for the intramuscular, I'm going to administer Haldol, which is 4 milligrams per 2 milliliters, so I know that I'm going to be administering 0.5 milliliters. And for this injection, I'm going to use a 1 inch long needle and a 20 to 25 gauge. And this is because muscle is harder to get through, and so we want a thicker diameter and a longer needle. And then for both, I'm going to be using the smallest syringe possible to allow for the greatest accuracy, so we can use a 1 milliliter syringe for both. So first I'm going to perform hand hygiene. And I'm going to be assembling my syringe and needle. So the first thing I'm going to do is put on my blunt tip needle on my syringe. And leave that there. And then I'm going to be using an alcohol swab to clean my vial. And I'm going to go from the inside out because that is the best practice technique. And dispose of the alcohol swab. Then I am going to draw up the correct amount of medication. So we want 1 milliliter for heparin. So for the sake of this demonstration, I'm going to use this needle. I'm going to remove the cap. And I'm going to pull out I'm going to pull out 1 milliliter of air just to create a pressure when we inject it so that it's easier to pull up the medication. So I'm going to put this in there and inject the air into the vial. And now I'm going to turn it upside down to avoid air bubbles and pull out the amount that I want, which is 1 milliliter. Then I'm going to put the safety tip back on. And now I'm going to make sure that I correctly label this needle with the drug, the dose, and the patient room. And then I can dispose of my blunt tip needle into the sharps container. And then I'm going to go and do the exact same steps for the intramuscular injection. So I would put on the blunt tip needle onto my syringe, and then I would open my vial, cleanse it with the alcohol swab. Then I would draw up the medication in the same way, turn it upside down to avoid air bubbles. Then I would cover the needle back up with the safety cover and correctly label it with the drug, the dose, and the patient room number, and then dispose of the blunt tip needle again. So now I'm going to perform hand hygiene again. And I'm going to put on my gloves. So now I can go to my patient's room and I'm going to confirm their ID. So I'm going to ask them their name as well as check their armband, and then I'm going to explain the procedure to the patient. So I would tell them that these are the medications I'm going to be administering. So I'm just going to use a swab to cleanse the area, and then I will pinch or spread and inject the medication, and then remove the needle and dispose of my supplies. So I'm just going to identify the injection sites and techniques for subcutaneous and intramuscular injections. So for subcutaneous, we can inject into the lower abdomen, the back of the upper arms, or the upper thighs. And for intramuscular injections, we can inject into the deltoid, ventrogluteal, or vastus lateralis. So I would landmark and palpate these sites, and then I would cleanse the injection site with an alcohol swab. So this is my injection site. I'm going to take my alcohol swab, and again I'm going to wipe from the inside towards the outside, following best practice techniques, and dispose of the alcohol swab. Okay, now I'm going to perform my injection. So since this person is of average size, for the subcutaneous injection, we can inject anywhere from a 40 to a 90-degree angle, whereas if they were a larger person, we would inject at a 90-degree angle. And then for the intramuscular injection, we're always going to inject at a 90-degree angle. So I'm going to take my syringe and remove the cap. And for the subcutaneous injection, I would pinch the skin. If I was doing the intramuscular injection, I would spread the skin. So this is heparin 1 milliliter, so I'm going to pinch the skin. I'm going to go in at about a 40-degree angle, push the needle in all the way, inject the medication, and pull it out. And then after, I'm going to put on this safety cap so that it looks like this, and then the needle can't stab anybody. For this demonstration, I'm just going to put the cap on like this. Okay, so now I can dispose of all my needles into the sharps container, and then I'm going to take off my gloves and dispose of my gloves into the garbage and perform hand hygiene again. And then the last thing I'm going to do is go and document the medication administration. So I'm going to put the time that I administer it and write that I will monitor and assess the patient to see how they respond to the medication.